Hey everyone, and welcome to RxIntern, a new podcast series brought to you by the MyPSA Advocacy Office. This series is all about guiding and inspiring pharmacy students as they get ready for their internship journeys. Today, we're diving into our very first episode of our series, where we are taking a closer look at intern life as a hospital pharmacist. I'm your host, Sin Lee, and today I am really excited to kick off our very first episode with a very, very special guest, Miss Jessie. Miss Jessie is a former hospital pharmacy intern, and in this episode, we'll be diving into what a typical day looks like for a hospital pharmacy intern, some common mistakes interns often make, as well as how you can better prepare yourself for your own internship experience. A great welcome to Miss Jessie. Thank you again for joining us today. To start things off, could you introduce a little bit about yourself and your career so far?
Hi everyone and welcome. So first of all, a big thank you to my PSA for inviting me, and I'm really happy to be here and super excited to share my journey with y'all. My name is Jessie and I'm a recent BPharm Honours graduate from Monash, Malaysia, and right now I'm currently awaiting my posting under the Ministry of Health to begin my career in a government hospital setting. During my time in uni, I also had the chance to go through various clinical as well as community pharmacy attachments, which gave me hands-on experience in different areas. During my hospital pharmacy attachments, I was posted at Hospital Sultanah Aminah Johor Bahru, HSA JB, and also Hospital Port Dickson HPD, where I rotated through various departments, including outpatient, inpatient, and also clinical pharmacies. And I really hope this sharing will give you some idea of what your attachments may look like, or if you have already been through it, maybe you related to a few of the stories.
Thank you so much for that lovely introduction. It's always really exciting to hear from someone who's just finished their studies and is getting ready to step into the pharmacy world. I'm sure that many of our listeners here who are either pharmacy students or fresh grads themselves will definitely relate to what you'll be sharing today. Let's move on to our first question. What inspired you to pursue a career in pharmacy and how did you choose your internship setting?
Right, so that's a really good question. Honestly, my interest in pharmacy started with a mix of curiosity and also a bit of personal experience. Growing up, I saw how important medications were for people close to me, even myself. So whether it is for managing their chronic illnesses or just helping people get through tough times in terms of the health, like for example, some infections or sudden drawbacks. So as a child, I was admitted to the hospital, even though I didn't really understand what was really happening at that time, but I clearly remember being surrounded by healthcare providers who were very calm and also knowledgeable. And that experience had actually left a strong impression on me. So when I got into pharmacy school, I just loved learning about how medications work, how medications were used in treatment for people, and especially how pharmacists can directly help patients by ensuring a very safe and also effective medication use. As for the second part of this question, as for my internship setting, I didn't really get to choose because our placement were arranged by the school, but I was lucky enough to be posted to HSA for 2 weeks in 2023 and also HPD for 4 weeks in 2024, where I got to see how clinical decisions were made and also how pharmacists are part of that process. And it just made me feel like, this is the setting that I wish I could work in the future.
I see. I think it's so amazing how personal experiences, especially from a young age, can shape our future career paths. And I also really like how you shared that your early on experience stayed with you and eventually led to your passion for helping others through pharmacy. All right, now let's move on to your internship experience and challenges. Let's talk about your first day. What was it like? Were there any memorable first impressions?
Right. So, yeah, my first day was definitely an adventure because my first day was at HSA and it was really, really huge. And I'm not gonna lie, I got completely lost. And I spent the first 10 minutes just to figure out which way to go to meet my lecturer. And honestly, that place really felt like a maze. But thankfully, after that, our lecturer guided us through the registration process. So that part wasn't as stressful. But once we were on our own, I was like pretty much a walking GPS failure in HSA. And our group was actually split into two during the attachment. So one group for one for outpatient pharmacy. For me, I started with inpatient pharmacy, and I was both really excited and a little bit nervous because when I got into the department, it was really like buzzing with activity. And right away, I could see how involved their pharmacists are in every part of patient care. And the inpatient department was really eye-opening because one of the things that really stood out to me was how the supply of medication go through layers and layers of screening by pharmacists. Each prescription had to undergo multiple rounds of verification before the medications were finally delivered to the patient, just to make sure that everything was correct and safe for that patient. And it really opened my eyes to the level of details and also responsibilities their pharmacists have in terms of making sure the right medication gets to the right patient at the right time.
Yeah, I can totally imagine how overwhelming it must have been to navigate such a big hospital on your first day. Like being lost, I mean, it's practically a rite of passage for an intern, right?
Yeah.
And I think it's so interesting and reassuring to hear how even small details like the many layers of medication verification goes into ensuring that patients get the right medication. Now, moving on to the next question. What were some of the biggest challenges that you faced as an intern, and how did you overcome them?
HSA, that was actually my first time working as a hospital pharmacy intern. So one of the biggest challenges I faced was applying all the knowledge I had learned in the classroom to real life situations in the hospital. So in school, you're taught all the theories like pharmacology, drug interactions, dosing calculations, and whatnot. But when you're actually in a hospital setting, I would say it's a bit different because suddenly you're faced with real patients, real prescription, and a fast-paced environment where every decision you make could actually have a very direct impact on someone's health. At first, it was a bit tough for me to bridge that gap between what I had studied and also what I had to do on the ground. In my school, we rely a lot on academic resources and also standardized databases. But when I stepped into the hospital setting, I realized that actually different institutions can use different guidelines, and hospitals may also have their own protocols that may not always match exactly what we're familiar with from school. So, for example, some of the drug references or dosing practices we used during our studies weren't exactly the same as what was followed in the hospital. At first, it could be a bit confusing, and I sometimes found myself wondering if I was doing it right according to what I had learned. And it made me realize that, knowing the theory is one thing, but being able to adapt that knowledge to fit the real world practices is actually a whole different skill set. What helped me overcome this was being open to learning and also asking questions whenever I wasn't sure. So I made it a habit to check with my preceptors after I've tried to do some research on my own and still couldn't find the right resources. So I started to see that actually a lot of these variations are based on specific formularies and even sometimes local patient demographics. So over time, I learned to be more flexible and more adaptable as I began to understand that being a good pharmacist isn't just about following guidelines exactly, but it's also about applying them appropriately in context, using your clinical judgment and knowing when to consult the right sources or right people.
Thank you so much for being so open about that. I think what you shared will really resonate with a lot of the pharmacy students here. That transition from classroom to clinical setting is definitely no small feat. And I really love how you emphasized adaptability and the importance of asking questions. The mindset of being proactive, staying curious, and taking in the initiative to learn from your preceptors really plays a crucial role in being a better pharmacist. I really agree with that. It leads me to our next topic, which is learning at growth. The first question is, what were the most valuable skills you gained during your internship?
Thank you for that question. So, one of the most valuable skills I picked up during my internship was definitely time management. So even though our attachment is kind of like a preview or a lighter version of PRP, but the pressure is still there, especially when it comes to case clerking in clinical pharmacy. I remember there were days when I had multiple cases to follow up on, and the number just kept growing as more patients were admitted each day. This experience really taught me on how to plan my day, prioritize tasks, and also, but still leaving some rooms for any unexpected issues that pop up. Another skill that really made a difference was being organized. Because when you're clocking cases, there's a ton of information to process, like a lot of lab results, medication charts, patient histories, progress notes, redhead tickets, and if you're not organized, it's so easy to miss something important. As I mentioned earlier, the workload build up day by day. So staying on top of each case is crucial to make sure that the information that you're clocking is accurate and also updated in a timely manner. Being organized also helped a lot in the outpatient department. So in that department, I had a chance to help with medication filling, and that's where I really saw how important attention to detail is. Even for the same medication, there could be multiple formulations, multiple strengths, and picking the wrong one, even by a very slight difference, could actually slow down the whole dispensing process. And this is especially critical in a busy hospital like HSA, where the prescription volume is really high and efficiency really matters in this department. So yeah, time management and also being organized, they might seem like very simple everyday skills, but during my attachment, they proved to be absolutely essential, and I know that they will be even more important when my PRP starts.
Yeah, it sounds like your experience really taught you a lot about time management, as well as having to manage your task well, while still staying focused on like the tiny details. And I can only imagine how crucial these skills will be once your PRP starts. And I think it's also really great that you're really working on improving these skills. So yeah, our next question for you is, were there any mentors who had a significant impact on you during your internship?
Yes, definitely. So I was really lucky to be guided by some amazing pharmacists throughout my attachment. And honestly, each of them had a unique impact on me. They weren't just there to like supervise us, but they genuinely took the time to teach us and share their experiences and also sometimes challenge us to think critically. So in both the inpatient and outpatient pharmacy settings in HSA, my preceptors were incredibly patient and supportive. They walk us through the entire workflow of how their departments manage medication supply on a daily basis. One of the most memorable parts was getting the chance to handle psychotropic medications under my preceptor's direct supervision. It is really something that made the learning experience feel very real and hands-on. And I especially appreciated how they encouraged us to ask questions and think beyond the textbook knowledge. They also created a space where it was okay to not know everything as long as we are curious and willing to learn. And then in clinical pharmacy in HPD, the preceptors were just as inspiring. I learned so much about the importance of being detail oriented, answering doctors' medication related queries, and also practicing good antibiotic stewardship. Each receptor or mentor taught me something different, and I'm truly grateful for the time and effort that they have invested in mentoring us. And their guidance really shaped my attachment experience and also gave me a clearer picture of what kind of pharmacist I hope to become in the future.
That was an amazing reflection. And it sounds like you really had supportive and inspiring group of mentors. I also really love how you describe them not just as like supervisors, but as people who like genuinely cared about your growth. And I'm sure that that will definitely shape you into a better pharmacist in the future. Right. Let's move into hospital workflow and interdisciplinary collaboration side of things. Could you walk us through the medication dispensing process in a hospital? And how do you think it's different from community pharmacy?
For this question, I'm assuming that the dispensing process refers to the outpatient setting where non-admitted patients return for reviews or to refill their chronic medications, or patients who are being discharged from the hospital. So this process may vary slightly between hospitals, but generally they follow a similar flow. So firstly, the prescription will be sent to the outpatient pharmacy, and the first pharmacist on duty will receive the prescription and perform an initial screening based on the 5 Rs, which is the right drug, right formulation, right dose, right frequency, and also right patient. So if there are any discrepancies or concerns, the pharmacist will then contact the prescriber to clarify, ensuring that this prescription is really accurate and appropriate. Once the prescription is verified, the pharmacy technicians or pharmacy assistants will begin preparing the medications according to their queue number and placing the medications into labeled baskets and attaching the corresponding medication labels. Then a second pharmacist will then perform a cross check to ensure that these filled medications are labeled correctly and also they are truly the correct medications. And finally, the third pharmacist, who is also the dispensing pharmacist, conducts the last check before actually supplying the medications to that patient. So this pharmacist is also responsible for counseling the patient on how to take their medications properly, making sure that this is really the correct patient and also informing them about their next appointment or follow-up. As for differences with a retail pharmacy, mainly in terms of prescribing authority, I would say, because in hospitals, medications are typically supplied based on a doctor's prescription. But in contrast, in community pharmacies, pharmacies have more flexibility where they can assess and also manage certain minor ailments and dispense specific medications without a prescription by a doctor. So they also provide recommendations on complementary and also alternative medicines like health supplements or vitamins. And additionally, the range of medications differs between a hospital pharmacy and also a retail pharmacy. For example, psychotropic drugs are generally restricted to hospital settings and not so commonly available in retail pharmacies. Yeah.
I think it's so interesting how the process in hospital is so structured, with having multiple pharmacists in different layers involved in a verification of the dispensing process. I think this really underscores the importance of collaboration and attention to detail in ensuring patient safety, right? So it must have been a great learning experience seeing how this process played out in real life. Let's move on to the next question. Did you get to join ward rounds and what was the experience like?
Yes, so I actually got the chance to join ward rounds in Hospital Port Dickson. Just like my first day, it felt like I had just walked into a different universe because there were doctors discussing cases in the wards in medical terms. They are flipping through lab results. They're comforting their patients and caregivers while making clinical decisions just on the spot. And it really felt like rocket science at the start because as someone fresh out of the classroom, it was a bit tough to apply what I had learned because in school we studied diseases one by one, which is very nice and neat. But in the ward, real patients don't come in textbook form. They have multiple conditions. Some of them may have very complex medication regimens, and sometimes they can have very unpredictable responses to their treatment. So it was definitely overwhelming at first, but it was also eye-opening. Being part of the ward rounds actually gave me the chance to observe how pharmacists contribute to clinical decisions, especially when it comes to optimizing drug therapy and also preventing medication-related problems, especially antimicrobial resistance. So it made me realize that how important our role is in a multidisciplinary team, even though we're not always the loudest voice in the room. What was especially impactful for me was the variety of patients I got to see, from newborn babies in the kids wards to elderly patients who are receiving palliative care in the medical wards. Each case can come with different considerations, and it made me realize, just how dynamic the role of a hospital pharmacist can be. And of course, watching the pharmacists in action was really inspiring. They knew how to ask the doctors or the patients the right questions, how to make suggestions, and back them up with solid reasoning.
That was such an incredible sharing experience. And I can only imagine how surreal that first walk round must have felt, especially like getting to see how different patients have different diseases, literally from babies to like the elderly, right?
Mm.
And especially coming straight out of the classroom. I think you really made a really good point about the part where you said everything in school was taught in categories like hypertension and diabetes. It's all really nice and neat. But in real life, patients come in literally everything mixed together.
Yeah.
And it's not always that clear cut, right? I think that's where the real learning happens as well, right? Next, let's talk about handling patients and clinical scenarios. Can you share a memorable patient case where you felt like you played a meaningful role?
One of the most memorable patient cases I encountered during my attachment wasn't one where I personally played a major role, but it really opened my eyes to the meaningful impact that healthcare providers can have. So it was when I got the chance to observe the methadone maintenance therapy MMT program. Watching how healthcare providers work together to support these patients was honestly really inspiring. So pharmacists in particular were responsible for ensuring accurate dosing, proper storage, and also safe handling of methadone, as well as keeping a close eyes on patient adherence and any possible side effects from that medication or any potential misuse. So it wasn't just about giving medicine, but it was also about rebuilding lives, I would say, slowly but surely. Even though I was only there to observe, just being in that environment actually made me realize how powerful and also meaningful our role can be in terms of public health. And it reminded me that every task we do, even the ones that seem very routine, very boring, can contribute to something bigger, especially when it comes to helping vulnerable.
Your reflection on the MMT program is so insightful. And I think it's easy to forget that in healthcare, many of the most meaningful contributions happen behind the scenes in things like patient adherence, monitoring of side effects. And I can imagine how that experience gave you a deeper understanding of the value of pharmacy in a public health context. All right, now let's talk about something all interns definitely go through: the workload, stress, and adaptability. What's the busiest or most hectic shift you've ever experienced?
Okay, thank you for that question. So, as an attachment student, I wouldn't say that I had any crazy hectic shifts like what full-time staffs may probably experience. But there were definitely days that I felt packed, especially during the clinical pharmacy rotation. So, one thing that stood out was how the cases would actually start to pile up if I didn't stay on top of them. So, we started off with a very manageable number, but as more patients were admitted, the list just grew longer and we had to follow up on each one. It wasn't really like physically hectic, but it was kind of mentally demanding, especially when you're trying to clock efficiently and make sense of all the information that others had written down. So it can really be overwhelming if you're not organized enough. And we had to be quick as well, especially when doctors and nurses needed to use the patient files. We didn't want to delay the usual workflow because at the end of the day, we're just attachment students and we're there to learn without disrupting the team's usual pace, right? So that really pushed me to be more efficient and more mindful of my time. Even though we weren't carrying the full responsibilities of a PRP yet, this experience still taught me about uh how to stay organized, managing time under pressure, and also being respectful in your work environment.
I think it's so interesting how the mental strain of managing multiple cases and being mindful of the larger team's needs can just be as demanding as the physical workload. And I'm really inspired by how you handled it. And moving on to the next question, how did you manage balancing your learning while keeping up with the workload?
Actually, during my attachment, there weren't any formal classes, but we still had daily tasks to reflect on what we have learned that day. So every day we would write down what we experienced, whether it was about certain medications, patient care, certain prescription, or specific cases that we have encountered. While it wasn't as intense as regular classes, we still had to make sure that we keep up with these reflections and didn't leave them for later. So I made it a habit to do my reflections right after the day have ended. And I realized that if I left them for too long, it became harder to recall the details of that day. So I would jot down my thoughts and notes while everything was still fresh. And this helped me to stay on top of things and avoided last minute rush. So it wasn't always easy, especially on days when you feel like very physically exhausted. But keeping up with it just made things a lot smoother. It also like gave me a chance to look back on how I was doing and see what I have learned each day.
Wow, that's such a thoughtful approach. I'm sure that kind of consistency will definitely go a long way, just going little by little. And yeah, thank you so much for sharing that with us. Moving on, we'd love to hear some advice for all our future pharmacy interns out there. What are some common mistakes that students make during internships?
I would say one of the most common mistakes I've seen is asking questions without trying to do your own research first. Because I understand that we were students and sometimes it feels like, asking the preceptor is the fastest way to get an answer. But it's always a good habit to try and dig around first and make your own attempt at finding the answer. And it also shows that, you are proactive and more often than not, you end up learning a lot more by trying to solve the problem yourself first. Plus, if you have done your own research first, you will know exactly where you are stuck and you can ask your preceptor a more specific and more insightful question, which they would always appreciate.
That's such a solid point, and honestly, I think it applies way beyond pharmacy too. It's like really tempting to go straight to someone for the answer, especially when you're feeling overwhelmed or pressed by time, right? So, but like you said, that first step of trying to figure things out by yourself really does make a big difference. Moving on to the next question, how can students better prepare themselves before starting their hospital internship?
So for me, I would think that before starting a hospital internship, the best thing that we can do is to brush up on our basics. You don't have to know everything, but having a solid understanding of just core concepts like medication classifications, common disease states, and drug interactions, for example, can really help you to feel more confident when you first step in. Also, try to practice time management and also organization skills before your attachment because you'll likely be juggling multiple cases and tasks. So, being able to prioritize and also keep track of your tasks will be super helpful. So, whether it is to try and keep a study schedule or just organizing your notes, practice will actually make the real thing easier. But and also lastly, don't be afraid to make mistakes because it is all part of the learning process. I would say that no one is perfect, especially when you're just starting out. You're just an intern. You're not going to know everything or get everything correct on your first try, and that's totally okay because everyone can make mistakes. But the key is to learn from mistakes and ask questions when you need to and keep improving yourself. I would say it's a part of growing into the role. So don't stress too much if things don't go perfectly at first. Just take that as a learning opportunity and keep pushing forward.
That's great advice. Brushing up on the basics, practicing time management, and embracing mistakes as learning opportunities will definitely help students feel more confident. Thank you so much for sharing that. And lastly, let's wrap things up with our career and future perspectives questions. How did this internship influence your future career path?
These attachments in hospitals really influence my career path. So watching my preceptors in action, how they actually handled cases, how they actually work with the healthcare team and genuinely cared for patients, this was actually super inspiring. I just felt like, I want to be like them. They showed me that being a hospital pharmacist is about more than just dispensing medications. It's about critical thinking, teamwork, and truly making difference in people's lives. And I'm really excited to start my career in this role, and I hope to grow into pharmacists like they are.
I think it's really amazing, like how your preceptors inspired you by showing the real impact of being a hospital pharmacist is. And it's clear that their approach to patient care and teamwork left a lasting impression on you. And I'm sure that you definitely grow into a fantastic pharmacist with that mindset. Moving on to our last question. What's one big misconception about hospital pharmacy you'd like to clear up?
One of the biggest misconception about hospital pharmacy is that pharmacists just blindly follow doctors' prescription and supply whatever they prescribe. But in reality, we're not vending machines. We're not order takers. They are ensuring that the medication prescribed is the right one for that patient. Pharmacists review prescriptions for dosage, interactions, and potential side effects. They also work closely with doctors and even patients and their caregivers to make sure that everything is safe and effective. So, hospital pharmacies are not just supplying medications, but also actively involved in patient-centered care while ensuring their best treatment outcomes.
Yeah, that's such an important point. Hospital pharmacists definitely do so much more than just dispense medication. They ensure patient safety by checking for interaction dosages as well as side effects. And your explanation really highlights the crucial role they play in patient care and treatment outcomes. So thank you so much for sharing that. All right, that wraps up our last question. A big thank you to Ms. Jessie for sharing her insightful experience in the hospital pharmacy sector. I'm sure the participants have gained some valuable perspectives on pharmacy internships in this field. And with that, we conclude today's episode of RX Intern. A huge thanks once again to our wonderful guest, Miss Jessie, for taking the time to share her journey with us. So thank you so
Thank
much.
you.
If you enjoyed today's conversation and want to hear more about the world of pharmacy, make sure to subscribe and follow us on MyPSA's YouTube, Facebook, Instagram, and Spotify. Also, don't miss out on our next episode where we'll be discussing community pharmacy internships. Until then, stay tuned and stay inspired.